Hey there, let's talk about blood pressure. In simple terms, blood pressure is pressure of blood flowing in your blood vessels. Normal blood pressure is less than or equal to 120 over 80. Anything above that is considered abnormal. The medical term for this condition is essential hypertension. Elevated blood pressure is a very common condition among adults after 60, but it can be seen in much younger patients too. Very rarely, some of these very young patients have another cause for hypertension. For example, certain hormone problems, circulation problem to kidneys, among other causes. These are extremely rare. These patients have what we call secondary hypertension. We're not going to talk about these rare scenarios. This video is only about essential hypertension, the regular blood pressure, which is the most common. What are some of the factors implicated in elevated blood pressure? Age is a major factor. We cannot do anything about age. Blood pressure can be considered as one of the ailments of age, unfortunately. Genetics is another factor which also we cannot do anything about yet. But there are factors which we can change to help control blood pressure. These are weight loss, increased physical activity like daily aerobic exercise. Diet wise, there's a diet called DASH diet, which is proven to help with blood pressure, DASH. Expanded form for that is dietary approaches to stop hypertension. What it mainly is low sodium, which is low salt, low carb, low sugar, low fat, high potassium diet. Decreased alcohol consumption will also help. Out of this, the most important dietary intervention will be low sodium or low salt diet. A word of caution about potassium in your diet. We do not recommend getting over-the-counter potassium tablets for this. Some patients should be, of course, on potassium medication prescribed by their doctor. We recommend increasing consumption of food rich in potassium, especially fruits, to help with potassium. Also, if you have known potassium problems from your blood test, most likely because of kidney issues, please talk to your doctor before increasing potassium in your diet. I'm stressing this because potassium can be dangerous if elevated above normal. High blood pressure can be called a silent killer because it can go undetected for many years before irreversible complications happen. The disease go undetected because patients often have no symptom whatsoever. Now I'm going to touch on how we manage blood pressure. Like I said, blood pressure is considered to be abnormal when it is above 120 over 80. Above 130 over 80 is considered stage 1 hypertension. We recommend usually lifestyle modifications and dietary changes with stage 1. But when above 135 over 85, we decide to start treatment if lifestyle changes are not helping. We usually give 2 to 3 months time to control blood pressure just by lifestyle modifications and diet if borderline elevated. We start medications right away, of course, if blood pressure is very high at the first visit or if there are signs or symptoms of complications from blood pressure already. Some of the symptoms of blood pressure could be headaches, dizziness, fatigue, blurry vision, but we don't want you waiting for these because many times the first symptom would be from complications of blood pressure. Oftentimes, blood pressure, like I said, has no symptoms. Some of the common complications of untreated blood pressure are strokes, which can be clot or bleeding in the brain, heart attacks, which is damage to heart from clogging arteries, congestive heart failure, which is failure of heart to pump efficiently, kidney failure, which is inability of kidneys to clear toxins out of your blood, which sometimes resulting even in dialysis. Damage to your eyes is another one, etc. So as you can see, these are all very permanently disabling conditions and often life-threatening also. This is why it is important to treat blood pressure. Our field's motto is prevention is better than cure, and some of these conditions as you can see, are not curable, may be controllable, but not curable. So treatment of blood pressure is very important, and it usually entails 1 or 2 tablets a day, sometimes even more. There are different classes of medication for treatment of blood pressure. Commonly used medications are generic and cheap and very effective in treating the condition. So treatment of blood pressure is not expensive. If well controlled, it usually entails 2 doctors visits every year, 6 months apart, and there will be a blood test also involved. And the visits are usually to monitor for complications from blood pressure, to ensure control of blood pressure, and for monitoring for rare side effects from medications. I want to clear one myth about blood pressure medications because I hear this from patients often whenever I try to start a blood pressure medication. Many patients are usually reluctant to start medications because they believe that the medication is going to alter their body in some way, making them dependent on the medications. This is not true. Some patients, once started on medications, has to stay on it because even after lifestyle changes, their blood pressure do not get better. Like I said before, there are other factors at play like age and genetics, which you cannot do anything about. Some patients are not able to achieve lifestyle changes too, so they would have elevated blood pressure no matter what. But there are also instances where patients are able to control their blood pressure with their lifestyle changes and being able to stop blood pressure medications eventually. I would also like to quickly mention about 2 scenarios which could be a little common in blood pressure management. One is white coat hypertension, and the other one is called masked hypertension. White coat hypertension is when a patient's blood pressure is normal at home or at other places but raised at doctor's office. These patients usually do not treatment because their blood pressure is only high at the doctor's office. This is mainly because of stress of being in a doctor's office. The other scenario is the exact opposite. In masked hypertension, patients have normal blood pressure at doctor's offices but elevated blood pressure everywhere else. These patients should be treated because they could get the complications. Both white coat and masked hypertension are confirmed by asking patients to take blood pressure measurements at home. Sometimes we order something called ambulatory blood pressure monitoring to figure this out. So the take-home message is you should be seen by a doctor at least once a year to check for blood pressure. This is a thing which is done during your physicals, if you get that. If for some reason that is not possible, buy a blood pressure machine which is very easy to use and keep checking your blood pressure at least once a month. I would recommend you buying one of those which you have to put on your arm, not the wrist one. I would also recommend checking your blood pressure irrespective of your age. Incorporate lifestyle and dietary modifications even if your blood pressure is normal. If blood pressure is consistently above 135/85, please go and see an internal medicine or a family medicine doctor as soon as possible so that your blood pressure will be treated appropriately, preventing dire complications from it. Again, remember, prevention is better than cure. Having said that, I'm concluding this video. If you have any questions or comments, you could put them in the comment section below and I will try to answer those. Don't forget to subscribe and click the notification button so that you'll be alerted when I post my next video, which is hopefully next week. So bye for now. Take care.